We're sourcing most of the food and other essentials locally to provide a boost to our business and community. And also, since there may be unsheltered members of our community in the facility, we will be offering wraparound services, including basic medical care, availability of behavioral health care, and other services. We really appreciate the support of the community. I know these are tough times for everybody, and we really thank the residents of Everett and the residents of Snohomish County for their support. Vulnerable people need someplace to go, and this facility will really give them that option. So with that, I'll come back for questions later, but I'll turn it off to Dr. Spitters now.
Thank you, Executive Summers. Good morning, everyone. Similar to our meeting last week, I'd like to first share a few brief updates. Those updates include case counts from Snohomish County for COVID-19, discussion about continued concern on the growing number of cases in long-term care facilities, and highlights from the drive-through testing site that the Snohomish Health District launched last week. And then last, to address the isolation and quarantine facility. As of 8:30 this morning, Snohomish County cumulatively has almost 1,300 case reports of COVID-19. Among these, almost 80 have been hospitalized, 66 remain in isolation at home or in long-term care facilities. Over 500 have completed their isolation period and recovered. Sadly, amongst these 1,200 or 1,300 cases, there have been 33 deaths, so right around 2.5% of reported cases succumb to the disease. In addition, we have almost 600 cases that are still being investigated. These numbers may adjust slightly before our 2 p.m. update, which occurs online daily. On Friday, I reported that we had 7 long-term care facilities in Snohomish County that have at least one resident with COVID-19. I must tell you that as of this morning, we have now more than 24 long-term care facilities with either a patient or a staff member or both that has been confirmed to have COVID-19. We have just 2 facilities that have more than 5 cases. Those remain the Josephine Caring Community in Stanwood, with 21 cases total between staff and residents, and Sunrise View in Everett now with 31 cases. The increase in the number of facilities with cases is quite concerning, although I'll admit not a surprise. Given the age structure and of the population there, they're more at risk for severe disease, so more likely to be symptomatic and get tested. Also, just the nature of the facilities with visiting and with care providers often serving multiple sites, they are at increased risk of exposure. Furthermore, limited staffing and personal protective equipment, gowns, masks, goggles, gloves, those remain a precious and scarce resource in those settings. The Health District continues to work to establish broad surveillance, ongoing outreach, and technical assistance, and sometimes on-site assistance with identification and control of COVID-19 in these settings. In the meantime, I encourage the staff and leadership at all long-term care facilities, whether they be skilled nursing, assisted living, or adult family homes, to ensure they're complying with all local, state, and federal guidelines, including those limiting visitation and entry into facilities by those who don't absolutely need to be there, and daily checks on the health of staff members and excluding ill staff members from work. While these guidelines may feel restrictive, both for the facility and the residents, they are in place to protect the workers, the patients, and our communities. The Health District has a team of staff working to support these facilities when respiratory illness is present. In order to do that, we need the facilities to be proactive and transparent, and should not wait for multiple people to become symptomatic. If it appears that there's a respiratory disease in the facility, please contact us early. Our goal is to work together with you and the community to limit the spread of infection, both inside facilities and outside. Toward that end, today I am signing a health officer's order regarding isolation and quarantine for people affected by COVID-19. And this order includes two pieces. One is a directive stating that everyone with COVID-19 symptoms who has a test result pending shall remain in quarantine while waiting for those test results. And the second part is an order directing everyone who is tested positive for COVID-19 to remain in isolation until no longer infectious. This means that you should not leave your home or recovery facility except to receive medical care, and when doing that, should call ahead. Please don't wait for the health district to contact you to advise you regarding this. If you're waiting for a COVID-19 test result, stay home. If you've got a positive test result, stay home. And healthcare providers likewise should repeat this counseling to all patients whom they are evaluating for COVID-19. Detailed instructions for patients on and as well as for those exposed to COVID-19 can be found on the Health District's COVID-19 website under the tab People with COVID. For these individuals, you should only end isolation under the following conditions. One, if your test result's negative, then once your symptoms are improving and you've been without fever, you can go about your daily activities. For those with positive tests, you must stay home and away from others. Even in your homes, try to stay in a separate room from others until 7 days have passed since the beginning of your illness, or until 3 full days have passed since your fever stopped and your cough began to improve. And it's whichever of the two is longer. And in most cases, it will be that 3-day period after the fever resolves. We understand this is a challenging directive for some members of our community, as is the social distancing that is essential to flattening the curve and limiting the impact of this outbreak on the community and healthcare facilities. That's why I'm appreciative of Executive Summers' leadership in marshaling county resources to stand up this isolation and quarantine facility. It is essential for our containment efforts to address the pandemic. We are all working together to finalize the details before it becomes operational tomorrow, but the Health District will be working with healthcare partners to identify and direct individuals to be transported to this facility who have the need for isolation or quarantine and who do not have a safe place to do so. To share more about the operations inside the facility, I'd like to turn it over now to Dr. Goldbaum.
Okay. Hello, good morning. I'm Dr. Gary Goldbaum, formerly the health officer here in Snohomish County, and I find myself honored to be asked to return to service to help support this effort. I'd like to start by thanking Snohomish County. I think Executive Summers and his team have been incredibly responsive and are doing a great job in helping to support our efforts to limit the spread of COVID-19. And also to acknowledge my colleague, Dr. Chris Spitters. He's taken on that position, a role that I also held in the past. We are opening tomorrow a facility at the Angel of the Winds Arena. It will be capable of housing at this time up to 100 shelterless folks. It can be expanded to accommodate more. All of the people who will be admitted to the facility will be people who have either been exposed to someone who has tested positive for the virus, and therefore that individual needs to be in quarantine for up to 14 days, or it will also include persons who are isolated because they have symptoms of COVID-19 illness or have tested positive for COVID-19 illness. And so those are the folks who we know are capable of spreading the disease or are at very high risk for doing so. Whereas in contrast, those who are in quarantine, much lower risk, we're monitoring them to identify if they develop the symptoms and could therefore be spreading, capable of spreading the disease. The arena, and I really want to thank the folks who manage the facility. They've also been taking on a very difficult task. We have established in the two arenas, the ice hockey arena and the ice rink, separate facilities, sites separated so that we can accommodate those who are in quarantine versus those who are in isolation. I also want to thank all of the people in many organizations, including Providence Regional Medical Center in Everett, Compass Health, the Pioneer Health Services team, and certainly Snohomish County and all of its human services folks. Without their help, we wouldn't be able to get this moving. The site is going to be made as secure as possible. There will be law enforcement available outside the facility and security staff inside the facility so that we can keep it as secure as possible. I do need to highlight that although everyone admitted to the facility will be admitted with a health officer order that they need to be in isolation or quarantine, we are not a lockdown facility. These are folks who, like you and me, if we were in their same position, but we have a home, we would be quarantining or isolating ourselves at home. No one would be forcing us to remain in that facility. We certainly wouldn't be calling on law enforcement. It's really important to understand this because the facility is not going to be locked. We will be doing everything in our power to make it a facility that is comfortable, secure, and that to the extent possible is supportive for folks who oftentimes come to us with mental health or substance use challenges. So we will have behavioral health on site, medical personnel, including family medicine residents from the family medicine residency in Marysville, other volunteer physicians, nurses, and other staff. We will have also behavioral health specialists because many of these folks are going to benefit from having access to mental health services. This is not a medical facility. It is rather a home away from home for these folks. It's a place where we are hoping they will feel they are able to remain for up to 14 days. We will be providing meals. We will be giving them material, tablets, phones, so that they can stay in contact with others and have access to diversions. It is going to be a facility that we hope will be sufficiently attractive that people will want to remain in the site. And so with that, I'm open with my colleagues to questions.
And we did, this is Carrie with the JIC off screen here. We did get a couple of questions in advance that I wanted to put out there. Dr. Spitters, I was wondering if you could speak a little bit about how personal protective equipment is being allocated, particularly for long-term care facilities.
So just to repeat the question, how is PPE being allocated, particularly for long-term care facilities? I'm not at the where the rubber meets the road on that, but I know that the Emergency Coordination Center is the one that receives the shipments, and then those are allocated out according to the requesters. They've completed a form. Any facility that needs PPE has sent in a form, and then the release of the materials to fulfill those requests is based on a hierarchy that I haven't committed to memory, but the general idea is long-term care facilities with cases and acute care facilities with cases are at the top rung. The next rung would be other facilities that are providing clinical care or residential care to individuals with cases. The next rung would be other facilities that haven't had activity, say long-term care facilities without cases yet, clinics that haven't diagnosed cases yet. And then the lowest rung would be moving out even further out from the center of the circle, places that community organizations, service organizations that don't have a direct clinical role and don't have any ongoing transmission on site or need to provide care or services to affected people.
Another question that we've received is regarding testing. We've been asked, is there a shortage of testing supplies and have there been any concerns over faulty tests?
Excuse me, Kara, I was distracted. Could you
repeat that? No problem. Apologies, we were muted there. Sorry, the question is there a shortage of testing supplies and have there been concerns about any faulty tests?
Well, first, faulty tests, no. I think that, all tests, whether it's a blood count or blood glucose level or a COVID test, they have, inherent variability in the result they give, but they are right a very high percentage of the time, but that's kind of built into our system and their licensing, some acknowledgement that no test is perfect. But there's been no systematic failures. There've been a couple of news reports about people who tested negative and then positive or vice versa. Sometimes that can be due to variability in the test performance. It could also be related to the natural history of the infection in the individual. But to my knowledge, there's been no scenarios that suggest any systematic problems with testing. Nevertheless, we've encountered over time various bottlenecks in the testing sequence. That can be anything from patient care seeking to getting the specimen collected, transporting it, getting the specimen analyzed, and then reported back to the healthcare provider. So anywhere in that sequence can be a bottleneck. Early in the phase, it was a lack of analytic capacity in the laboratories, and what we had to triage the limited number of tests we have. Currently, there is a shortage of the swabs required to reach into the back of the nose that then go into the viral transport media. And so those swabs, those special swabs, and the tubes with the viral transport media are in short supply. I can't give you an exact number, but the last time I looked into it a couple of days ago, the state had, sort of a few days running supply in stock for testing in the public sector. So testing supplies is currently an issue. And then at times over the past couple of weeks, testing capacity, analytic capacity, the ability to run tests through the machine, so to speak, has been a problem. So there have been some ebbs and flows out of the laboratory end of this as well.
We have a couple of more questions here that I can answer. The first is, are there people ready to be housed in the facility when it opens tomorrow? I don't know that we have anyone who will be ready to move to the facility immediately. I know that once the facility opens, Providence and potentially the health district will be able to begin referring folks. I am speculating that within the first week, we will probably have half a dozen people, and it could certainly go up much quicker over the next few days. There's a question about people who walk away from the facility. So again, they all have a health officer order, and the question is, will they be arrested? And Dr. Spitters?
Currently at this time, if someone does disobey well, first let's talk about when people do, let's say, try to leave. So both the internal staff will try to persuade them of the benefits to themselves and the community of them staying to continue their obligatory period of time in there for the protection of all and for their own well-being. If that fails and then they exit the building, there is law enforcement around the outside of the building who will again try to engage these individuals around, you know, the benefits to all and their legal obligation to turn around and go back in. Failing that, you know, given the trying to balance the needs of the community, the safety of the law enforcement official, and you know, the benefits and risks of, you know, trying to physically engage someone to arrest them, and then, you know, put someone in jail. That's not quite, you know, that's a last resort that we'd like to try to avoid, both because for law enforcement safety, as well as introducing cases of COVID-19 into the jail is not a very good infection control plan for the jail. So those individuals will be in violation of a health officer's order. They may not be in the rare circumstance, which we expect, where someone continues to walk despite the law enforcement's encouragement to turn around. And if law enforcement doesn't feel that there's an imminent threat to anyone's safety by not engaging, then that person would walk away and then would be in violation of the health officer's order. And then we would consider what to do from there in terms of amplifying our efforts to control that individual.
So Dr. Spitter's question, what spurred the directive you announced today? Are people not doing what your directive calls for?
Oh, well, one is to, you know, we're trying to work not only, you know, sort of cross all agency within Snohomish County, but it's good to be in harmony and coherence with our geographic neighbors. And Seattle-King County, Public Health Seattle-King County issued a similar order over the weekend. That makes a lot of sense, especially as the case counts continue to mount, and both the duration of time until we're able to reach infected individuals over the phone after they've been diagnosed and the positive result comes through, that can take a day or two. And in some cases, especially if case counts continue to increase as time goes ahead, longer periods of time to reach them, or some we may not be able to reach. And so this is part of a process of just building in the obligation to quarantine or isolate as appropriate, regardless of whether you've heard from the health district or not to do it. It's now effective for everyone. So it's really to remain in harmony and to follow a good idea set forth by Seattle-King County, which is just to put the community on notice that this is what's expected, and it's now in order.
Right, and we have one additional question that was submitted in advance, and then we will wrap up here as we're coming up on noon. The question is, when someone does die of COVID-19, how is that confirmed?
Well, so if someone has been, the majority of those deaths have been people who get a febrile respiratory illness, they get hospitalized, and then they're one of the 1% or so of people infected, or at least of counted cases, whose condition deteriorates, critical care, and then ultimately they die. And so that it's that sequence of events. Usually the end events are multi-organ failure of the heart, lungs to do their job, and then the patient dies, but that's caused by the infection. And so a death certificate would indicate that. For people who have, the only other way to be classified as a death due to COVID-19 would be a death that falls under the jurisdiction of the medical examiner. And then the medical examiner, based on the condition or immediate cause of death, has reason to suspect that COVID-19 was involved, and they test the deceased person's body for COVID-19. And then if it's positive, then it's attributed to COVID-19. And there have been a handful of those, but the majority are the first instance, people who are hospitalized and then die.
All right, thank you. And it looks like we got 2 more questions real quick. I don't know if we're able to answer those briefly. One is, will the wraparound services include Suboxone treatment?
Yes, we will be able to provide medically assisted treatment in the facility. Those who may be taking methadone, it will be brought to the facility to be administered to those folks. Those who are taking Suboxone, buprenorphine, they will also be able to have their medication delivered to them as well. We will hopefully be able to also initiate treatment with buprenorphine. That's a little more cumbersome. We're still working out the details of that, so that hopefully we will be able to provide even more services on site that make this a really valuable tool for the entire community, not just addressing COVID-19, but other issues as well.
And the other question, Dr. Spitters, is, are you extending the March 17th order regarding social gatherings?
That's correct. We have 2 prior orders from March 11 and 17 addressing gatherings, and although the short answer is yes, our legal counsel is working on that right now at the same time as the other order that we've been discussing, to extend the provisions of those March 11 and March 17 orders until further notice.
Perfect. Thank you everyone for joining us. We're going to go ahead and wrap up here, and keep an eye out for future media availabilities. We'll be sending out advisories for those as we get them set up.